Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, treatment of gastric ulcer complications. In a gastric ulcer, if the patient has either intractable gastric ulcer or bleeding, then if it is a type 1 gastric ulcer, according to modified Johnson's classification, we should do a distal gastrectomy should be done. If it is a type 2 and type 3 gastric ulcers, then we can do a truncal vagotomy with antrectomy can be done. This is done for intractable or bleeding gastric ulcers. If there is perforated gastric ulcers, then for the type 1, we can do a distal gastrectomy is done in the stable patients, and you can also do, if the patient is unstable, then you can do a biopsy with the patch closure can be done for unstable patients. Then, if the patient is if it is a type 2 or type 3 gastrectomy, then if the patient is unstable, we should do a patch closure is done, and if the patient is stable, you should do a truncal vagotomy and antrectomy is done in these patients. Then, if there is obstruction in the gastric outlet or gastric outlet obstruction, then first and foremost, because gastric ulcers can be associated with malignancy, you should rule out malignancy, and then following that, we can do a truncal vagotomy with antrectomy can be done to the patient.
thank you and thank you for watching.